Hello and welcome to the second Accelerating Healthcare Access webinar. I'm so glad you could join us. I'm Ashwin Nayak. I'm an Ashoka Fellow and I'll be your moderator today. Let me start with a brief introduction to Accelerating Healthcare Access movement. The Philip Foundation, Royal Philips, and Ashoka have joined hands to look at some of the most pressing healthcare related problems in developing countries. Philips Foundation's mission is to reduce healthcare inequality by providing access to quality healthcare for disadvantaged communities. They are responding to this by deploying Philips expertise, innovative products and solutions, and by collaborating with key partners such as UNICEF and Red Cross. Ashoka, as many of you know, is an international organization present in about 90 countries, working with about 3,500 top social innovators around the world. These social innovators are creating practical and scalable solutions across many different geographies and subject areas, including health, education, environment, gender equality, and more. Ashoka is also working on creating everyone a changemaker world where each person finds their power for good by mastering empathy, teamwork, leadership, and change making. Philips Foundation and Ashoka have found a great common ground in the fact that we are both interested in supporting movements that are sustainable and can be scaled at a country or a continental level. We are excited to join our unique perspectives and experience in this accelerating healthcare access collaboration. The purpose of these webinars is to explore the unique challenges of providing quality healthcare in developing countries. To this end, we present a variety of first-hand accounts from diverse leaders in healthcare world and also invite questions and comments from you as participants. On the right side, you will see an option to ask questions. So if you could just write down your questions, we'll take it up during the course of the webinar. The first webinar addressed the challenges of infant and maternal health. And the second webinar, which is today, we are focusing on the unique challenges of last mile health, delivering access to care at the last mile in some of the remotest countries, remotest areas. We are so happy that all of you have joined and we have an excellent panel today. I'll briefly introduce them. We have Tinky, Yost, we have Anne and Randy Hamlin. I will request each one of them to do a quick intro about themselves, their organization, and what they are doing in the area of last mile health, and then we can jump into our discussions. Shall we start with you, Anne?
Thank you, Ashwin. My name is Angie Teemo, and I work for Amref Health Africa in Kenya, and Program Director for Reproductive Maternal Health. And my interest in last mile health is because as an organization, we work a lot with communities that are hard to reach. And we have to reach women, girls who are in far-flung areas, who have very low access to healthcare services, and what is available there is not of the best quality. And so this subject quite excites me.
Hi everyone, my name is Tinky. I'm the CEO and founder of ClickMedics. ClickMedics was founded about 8 years ago out of MIT as a response to a simply stated project challenge, which was create a business that will impact over 1 billion people. So from that perspective, when you look at the problem of over 1 billion people with lack of access to care, to healthcare, what we thought is we have to include mobile phones and technology as part of the solution. And not only are we going to do that to be efficient, we're going to support all the existing health organizations, whether they're hospitals, clinics, social entrepreneurs, and or even commercial programs like pharmacies. We enable them to do more of what they do, to do better at what they do, to be more consistent in what they do. And by doing that, we can help create jobs, training skills through the use of ClickMedics technology. And we'll go over more of that as we go over this discussion panel, but it's absolutely amazing journey so far. We are now in 23 countries we serve about 1 million people all through our partner organizations who are the first line health workers and doctors.
Great, thank you, Tink. Can I request Randy?
Yeah, absolutely. It's great to be a part of this great panel, and I want to welcome everyone to the event. My name is Randy Hamlin. I'm the business leader for point of care ultrasound at Philips. At the highest level within Philips, we are on a mission. That mission is to reach 400 million lives by the end of 2030. And being in the ultrasound space, especially point of care, our particular focus is on increasing access to ultrasound, which is, in our minds, extremely underserved across the planet. And we've been involved in point of care with reaching that last mile for well over 5 years in my organization, and we'll share that in a little bit. But it's an exciting opportunity. It's not an easy problem to solve, for sure, and it's going to be a team effort, I think, to really crack the code on that. Thanks. Thank you.
Thank you, Randy. Yost?
Well, thank you very much. Good afternoon, all. My name is Yost, Yost van Engen. I'm founder of Healthy Entrepreneurs, a social enterprise. I'm a Ashoka Fellow, and it's my honor to be here. Healthy Entrepreneurs is a last mile service provider operating in hard to reach and remote areas, empowering community health workers to operate efficient and effectively in their areas, not by providing them services, but by offering them a business opportunity. We are a true believer that using business, the incentives of providing and looking after customers in the remote areas is the way forward to serve first-line basic healthcare, including using point-of-care diagnostics, including technology like what Ting is referring to even bring in the expertise of doctors at a distance, and at the same time, most important, to empower people living in the community by not spending their money on transport costs to acquire access to basic health, but to actually save money, invest that in health or other life improvements, and therefore actually contributing to improved lives for 600 million people living in remote and hard to reach areas. Today, we have more than 6,000 entrepreneurs active in 5 countries, and we aim to continue our journey and becoming one of the larger players in the field of reaching hard to reach areas.
Yost, maybe we can build on that. If you can talk a little bit about what do these 6,000 people do in the 5 countries and how you're bringing technology and healthcare services to the remotest parts.
Yeah, well, thank you very much. Just to start with my background, I have a background in supply chain management, marketing and sales. My first product I worked with was canned meat, spam for the ones who are international. I've been able to distribute this over 100 countries and very effectively using the existing supply chains. Then I've been working for 7 years in supply chain of essential medicines, realizing there was an enormous unmet need, where despite a lot of great effort, we were not able to reach people, where my can of canned meat was reaching the very last mile. So that's why I created Healthy Entrepreneurs, and we are now in our model building on an existing platform, a fantastic platform of community health workers, where in the last 50 years have been invested a lot of time and effort to mobilize and empower trained people to serve in their community. But we are not empowering them. And that's in fact what Healthy Entrepreneurs does. We offer a business opportunity for an existing community health worker that lives in a remote area, offering an opportunity where they make an investment up to $40 US. And in exchange, we offer them a training. We offer them a smartphone with 3 different applications, and we offer them a credit enabling them to build a business. It's a rather straightforward business model, which in fact empowers mainly women to organize health promotion, consultations, partly on the spot, partly consultations by acquiring access to a doctor at a distance, and we ensure a continuous availability of all the healthcare commodities they are in need of to look after the people in their community. The role of technology is partly rather straightforward because we have like enterprise management systems registering all the sales, all the cash flows, all the purchases, expenses, which is rather straightforward. And the more sophisticated part is using apps, including educational movies in local languages to do health education, to use digital algorithms to support decision support on the spot, and to use technology where we do point of care screening, where the data is registered, the information is collected on the spot, and there the doctor at the distance is able to provide his or her observation and share the recipe, the prescription through the app to the patient again. So it's a tailor-made solution that includes entrepreneurship, that includes technology, that includes supply chain, and therefore putting well, all the pieces of the puzzle together. And that's what I think is very interesting of this conversation today, because we have AMREF. It's one of our partners that have been investing a lot in highly qualified people in the field. We talk with Ting of ClickMedics, who is actually one of our providers of technology offering doctor services at the distance. And Philips is also a key partner for us, as we are actually building on expertise and technology that Philips is supporting us with. So it's a great occasion to be here together.
Great. It sounds like a lot of different things coming together, Yost, in your model. And there seems to be three distinct pieces. One is building the last mile network, or the first mile network, as you call it. The second one is the supply chain infrastructure. And then you have services and diagnostics tools and doctor service, etc. Which one of this is more challenging, building the network of entrepreneurs or building the supply chain?
Well, or maybe the third option, that could also be the most challenging. In fact, we have started our business by only building supply chain. And I realized that by offering access to products only, we don't solve the issue. So it is, in fact, there is a need to provide access to health knowledge and expertise in order to make sure that products are supplied properly and people get exactly what they need. The challenge of acquiring and building a network, well, we have learned and we cracked that nut, so we know how to do so. We are able, with all the improved lessons, to mobilize and recruit people that after 24 months are more than 90% is still active. So I think we do quite well. Mainly women, mothers that are well established in their community. They have proven to be the most successful. The supply chain is a matter of discipline and organization, and that's where I believe always my expertise comes in, because this is where the international expertise comes in. And then I think the most exciting part is now, as we have this established network of like 6,000 entrepreneurs, we now are innovating within the network, using the network to offer additional services, because this network, this infrastructure offers a great opportunity. And I think also from AMREF's point of view, we will realize that previously projects had a beginning and an end. And as we are a financially independent organization that gets investments in, so we have our ongoing operation, we are building a new infrastructure that helps people to move from acquiring access to someone to keep someone on treatment and to keep them connected. And that's the next stage where we are moving towards. And well, that's also where new services come in.
Maybe at this point we can bring Anne in. AMREF also works in the remotest parts of the continent, and maybe you could share some of the learnings you've had in strengthening the human resource at the last mile that Yost just briefly touched upon.
One very important thing has been to ensure that community health workers have the right skills and also they have the right tools to be able to support household right from the homes to the whole continuum, to the formal healthcare system. So we've worked a lot with, give an example in Kenya with over 50,000 community health workers through the government system and with other partners to ensure that community health workers have the skills. And in instances where we can augment face-to-face training with technology, we have been able to do this so that they're able to learn on the go. Community health workers are usually, in most instances, volunteers. So you have to sort of think of the other chores in mind. So you have to have their training planned in such a way that it doesn't take up all their time, because they have also to look for a livelihood. So, and also to that end, what we are doing is to push to lobby and advocate for community health workers to be remunerated and to be incentivized whether through government or through creative models where the system itself is able to incentivize them as they provide services. So that is one area that we are working on. And the whole issue of technology has already been mentioned, and I can't talk much more about that because it's been very instrumental in fast-tracking the achievements that we want to see, and building partnerships with other private sector, working with like local telcos, like here in Kenya with like Safaricom Foundation, M-Pesa Foundation has been very instrumental. And also the other thing is not to forget how we can also equip the healthcare workers in the formal healthcare system with tools, with easy to use equipment, so that they're able to deal with the day-to-day challenges despite their few numbers. Yeah, that's what I would add on to do with human resources and community health workers.
And you also have a unique challenge of people moving from place to place, the communities who are not in one place, and the unique challenges that brings in on how do you provide care or access to a community which is always on the move. Can you talk a little bit about how you're tackling that?
Absolutely. Like I would give an example of one community in Kenya that is quite mobile. It's a nomadic pastoralist community in northern Kenya. And how we've worked with this community is to ensure that community health workers are part of the migrant group. So they are moving with this group, providing health messages and providing screening as they move along to look for pasture for their cattle, for water. And also along these migratory routes, what we've done is to put up container clinics, very simple primary health care units where a nurse or a midwife will man a center. And once the community passes through that point, they are able to offer services, simple primary health care services such as antenatal care, immunization, family planning services, screening, even for non-communicable diseases. And once the community passes that point and goes to another area, then they'll find another container clinic where that nurse will have moved to that container clinic. So it is placing, ensuring that the healthcare services that we are supporting are also well aligned to the lifestyle of the community.
Yeah, that's very interesting to see how you have to tailor it to unique situations on the ground. Maybe at this point we can bring in Ting. Ting, you heard both Yost and talk about the human resource angle of last mile health, and you came at it from a very different angle. You started with the technology capability, building the technology backbone, and decided to partner with other organizations like AMREF and like Yost's organization, Healthy Entrepreneurs. What seems to work for a partnership like this, where you are building the technology backbone and somebody else is doing the last mile delivery?
Yeah, it's a great question. So when we started our technology company, about 8 years ago, what we were trying to prove is that we can create a mobile-based application that's very easy to use. And initially, we tried it with health workers, and our concept is literally OneClick Health. So there's, an icon for the disease or product that they're trying to feature. And once they tap into that, everything works almost like a kiosk. Like when you check into the airport, it tells you what to do every step of the way. And we found that as one of the easiest ways to get someone with very little training or no training at all to know how to use an application. And they can deliver as complex of tasks as screening for diabetes or hypertension or maternal or child health care. And a lot of that is understanding sort of a process of how do you do the screening, what questions do you ask? And when we worked with doctors on the other end, because in our work, we want to close the loop, we want to identify a healthcare problem, then we want to provide enough information so a remote doctor can look at everything and actually provide the right diagnosis and the right treatment. So it doesn't end at having health workers collect information. The doctors are alerted once information is submitted. Then they provide treatment instructions even. And then when the health worker sees it, they're actually following the instructions to administer treatment, What was so fascinating about this model is that after a while, 10, 20, times of doing this, the health workers have learned to spot potential issues, to be more engaged and proactive in screening because they're recognizing the symptoms. They're also learning and practiced administering some treatments as well. And as they also go through a lot of the counseling and disease education with the patients, they're obviously learning and becoming experts themselves in terms of education. And what's also empowering is that health workers and frontline workers are actually really great at engaging the patients and their family members, explaining things in a way that could be even better than doctors. So what we learned is if we focus on the technology, enabling the frontline workers to be better and do more of what they do, then we can truly achieve that billion people goal of improving healthcare.
Fascinating. I think that's a great overview of how technology can be used to accelerate some of these access issues. On the same lines, maybe I can request Randy.
We've learned a lot, and I'll speak specifically to ultrasound. If you go back in time, our model was to partner with NGOs to provide equipment, ultrasound equipment, then that would be used. Our NGO folks would train the community folks on how to use the equipment. Ultrasound at times can be very complicated to use, complicated to interpret. And that model did not work. And it didn't work because when the trainers left, there was no sustained maintenance of keeping the quality of use. Pretty soon, the local clinicians were no longer using the equipment. And in the next visit, the equipment was sitting in the corner, unused. And so this model was proven to be very unsuccessful. However, all is not lost, right? We've learned, first of all, on the product side, we decided to take advantage of the world's biggest platform. We have the smartphone. And with that, developed technology that would be more conducive to being in very rural, rugged areas. And so we developed at Philips an ultrasound machine that's all encapsulated in the transducer that plugs into the smartphone, so that we took advantage of this platform that was out there. Now, the advantages that we immediately were able to look at was reliability. If the product doesn't break, obviously, then the issue with service doesn't enter itself. Having something extremely easy to use, so an app is downloaded onto your smart device that runs the ultrasound machine. The nature of an app, of course, is simplicity. So we're being able to start to move technology in solving some of those barriers from the learnings that we had in the past. I think what is now in front of us is on the human resources, as my colleagues have been talking about, which is the criticality of them playing a role in this solution, and how do you stay connected with them? So from a technology perspective, of course, there's some excellent tools. We've developed, I call it a Skype for ultrasound, to enable the local user of the Lumify device that I just showed you here, that can be live connected to any physician in the world to have real-time education and support. And this foundationally has bridged some of the gaps that we have learned over the time to be maintaining the level of expertise. And then especially if the migratory nature of people moving around, some new folks can be trained more effectively, more efficiently, and more timely. So those are some of the learnings that we've had in our ultrasound journey so far.
Great, thank you, Randy. And Yost, from your side, one of the themes that we are exploring through these webinars is how large corporations like Philips and social entrepreneurs on the field are collaborating and developing innovative models and products. So from your perspective, Yost, you obviously work with Philips and the team at Philips. Are there other private sector collaborations that you are engaged with, or Can you talk a little bit more about the work that you do with Philips and how that is developing your business model?
We are a social enterprise. We are still in a kind of startup stage. We have a team of in total 40 people working with us, amongst 6 or 7 international staff, and the remaining part is all in Kenya, Uganda, Tanzania, and Ghana. And so with this small team, we are doing great things. I'm always amazed what we are able to achieve together. But at the same time, we also have our limitations in capacity, and especially when it comes to specialisms, special knowledge regarding either technology or marketing or communication or investments or well, to set up a new campaign for awareness. This is where partnership comes in. And we realize in collaboration with Philips, but also with another large corporate that's also connected to Ashoka, Boehringer Ingelheim, we are able to learn from highly motivated people working in those corporates that are actually having the expertise available. They're more than willing to share. And so we appreciate the individual commitments and interest of people to join us in our journey. And also we sincerely appreciate the support of the corporates to enable their employees to provide expertise, knowledge without any restriction. And I can give you an example. Healthy Entrepreneurs is in a funding round raising investments money. And this is something I'm doing for the first time in my life. And I've been literally trained and coached by one of the investors of Philips Investments, that has been helping me out and teach me literally everything I had to go through in order to come to closing a deal with investors. Process. I made a joke with a friend of mine who's doing an MBA who takes 2 years to learn about it. And we concluded that the process we are in and the facilities we get are actually extremely important and also extremely effective. Last week or 2 weeks ago, we were in Ingelheim, Germany, where Boehringer Ingelheim was actually supporting a group of peer fellows working on social innovation. And also there, it's fantastic, the preconditions that are put in place with the clear objective of Boehringer Ingelheim, like what they copied from Silicon Valley, where small startup companies are facilitated to become as effective as possible in the shortest time period. It's Boehringer Ingelheim now also committing to do actually the same, to make sure that those solutions that have the potential are facilitated with all the preconditions to grow. And I think this is a way forward where, of course, there is a mutual interest, because Boehringer Ingelheim, as supplier of treatments, would like to understand how to reach untapped markets. And Philips also, I think, would like to understand how we are able to operate in hard-to-reach areas and where technology can come in. But it goes beyond the company interest. In fact, it's about working together on this social journey. And that's, I think, very inspiring.
Great. And you, through AMREF, also work with a large set of private sector partners. Any insights on what works in collaborating with the private players as opposed to working in the not-for-profit sector?
All right. Yeah, working with in partnership with private sector has been very beneficial. Let me start by saying that working in an NGO, we have a lot of trust with the community, a lot of understanding on the community challenges, convening power, and that kind of stuff. But where private sector comes in is in things to do with some vital skills as well as resources in various instances. And while in all these partnerships, we work with government as a regulator, as a provider of direction on policy, and provider for services, for some of the services, private sector has been very instrumental, I would say, especially at AMREF, in driving innovation, as well as ensuring that we are looking at models that are more efficient. And I'll give an example of one of the partnerships that we have with a development partner, the Dutch Development Bank, with Philips, with Acmea. Quite an interesting partnership. It's on primary healthcare PPP sort of, and just trying to bring in models at primary healthcare that can improve quality, can ensure that communities access services closer to where they live, And the county government that we are working with in Kenya has been very welcoming of this idea. It's a new model, and we hope that we'll be able to implement it to the fullest and even scale it up. We've also partnered with the private sector in many other instances where there hasn't been a lot of investments, especially by other institutional donors, like the area of non-communicable diseases. And giving an example of Kenya, where I live, we now have the double burden of disease. We are not just seeing the whole issue of communicable diseases, HIV, malaria, TB, and also other issues like maternal mortality, but we're seeing a rise on non-communicable diseases. And actually, the government has shown like 50% of bed occupancy in health facilities, tertiary facilities, is from non-communicable diseases. And we've been able to work with the private sector to do some screening, to talk about prevention, access to treatment, which is quite useful, even in an era where not a lot of investments have gone into that yet. We hope that in future, even we'll have more partnerships around that area. So yeah, I'd sum it up that private sector has been, so one is innovation, inefficiencies, and also bringing in other business values that are not very core to NGO or government setup that can help us realize even developmental indicators much faster.
Did you have to change the way you plan or think about your work because of the partnership with private
Absolutely. Yes, because when we are co-creating a program with private sector, we have to sort of have shared goals. And sometimes the way we traditionally planned is more to do with an institution kind of way, but also private sector has a way of working. I would say that you have to have results in a speedier way. There is a new way, other ways that we have learned on how to conduct social behavior change communication that has worked for private sector in uptake of, let's say, products that are in the market that are also very useful for behavior change among communities. So we have had to come to a common understanding, but also brought our understanding of how communities are engaged and how we can ensure that they're not left behind in all that conversation.
Great, thank you, Anne. And Ting, from your perspective, you work with a lot of NGOs who are at the last mile. Anything that you can share with doesn't seem to work, or the kind of partners that you actively look for, and what has been your learning working with NGOs from across the world?
Yeah, so we started our journey as a telemedicine platform initially, and we thought we would make, and we're a social enterprise for profit, and for the same reason, Yost wants to make everything sustainable. We have to justify why people would pay for our technology to scale what they're doing. So at first we thought doctors and patients would pay for the use of the technology so that they can get better care consultation. And turns out that's not the case, especially in emerging markets. There's not enough ability to pay at volume. You'll get initially, a few patients who say they would pay, but not at enough volume to make a business sustainable. So then we went towards private companies. We've worked with Medtronic, we've worked with insurance companies, and realized that at scale, you do need large amounts of funding, and everybody has to win. The patients have to get the care. The private sector have to make money, whether it's by selling their devices or therapeutics or medications. They have to have a way to make money by using your system. So we eventually broadened our platform to beyond just telemedicine, talk to a doctor and get a treatment, but actually screening, disease management, and follow-up care so that we can cater to more diseases. We now cater to hundreds of diseases, and many of them chronic diseases. And what we've learned from working with NGOs and Last Mile is they are incredible at getting that trust, as Anne mentioned. They know the community, they know how to get people. And at the same time, we work with private sectors who are trying to improve market access. They're looking for the people who need their technology. Those people would have never known about these new therapeutic devices or technologies unless you actually work with the nonprofits and NGOs, because they know the communities. So in my journey, it's been fascinating bringing the two together. Private sector who need access to more populations who need the help, and working with NGOs and last mile health workers to make that all happen, and then tracking that the intervention is helping. There are more people screened for diseases, they're actually getting treated. And the last part of it is that there is payment, that we're creating evidence around why governments may need to pay for it, why patients would need to pay for the better service, or even on the insurance scheme, why this type of level of intervention will lower the overall cost of care over time. So it's been fascinating. As a technology platform, we can bring different parties who are all part of the ecosystem for better health.
Great, thank you, Ting. I think, we have touched upon so many different topics, starting from building the last mile network that Yost spoke about, leveraging the power of partnerships that Anne spoke about, and then you're talking about how to build these productive relationships at the last mile. We will come back and talk about sustainability at the last mile, but before that, I want to touch upon one particular area which is always at the top of your mind when you're doing something at the last mile, particularly from a technology perspective. And maybe Randy can talk a bit about this, is how do you deal with support and training at the last mile when you don't have access to the equipment or access to the tool that you have produced, but it's deployed somewhere, it's very critical, and you have to make sure it's up all the time. So what are the kinds of things that you do at Philips to make sure that the last mile technology actually works?
Yeah, this has been a challenge. I mentioned earlier in my comments that in the past model, one of the problems is equipment breaking down, not reliable. Getting access to service, getting parts has been a real problem in being able to get the equipment up and running again. So this has been a real problem. Fortunately, there's been a lot of advancements in technology, in learning in the industry about how to design equipment for really no failures for many years, to be able to eliminate a lot of those occurrences that we've had. I think we've been talking in this panel too about the power of digital. There's absolutely, when you're looking at countries that have very few clinical trained people and yet millions of population, the answer has to be sitting right in the backbone of digital. Similar to your question is, how do we keep our equipment up and running? How do we stay connected? How do we reach more economically into the market and support? It is about staying connected, whether that's a smart device, which is what we've chosen to do, either in that delivery of looking at what is the issues with service, so you can remotely interrogate a product's current quality and performance without having to travel there. You can help deliver training and education without having to travel there. So these are different ways that are mandatory in our mind to be successful going forward. And it's something that I think we as a panel have all kind of resonated with in this process, because the human capital is the most critical aspect of this statement, frankly, and being able to give them capabilities to stay at the highest level of quality that they can to keep the products up and running is critical for us. So from the industry side, that's how we approach it.
Great, thank you, Randy. Now maybe we can take a last question before we open it up for questions from the audience. And this is about sustainability. And maybe Yost, from your experience, you can talk about this. Is the challenge with the last mile healthcare access is it's very hard to develop a sustainable model, and people have tried in various ways to do this. That seems to be an ongoing challenge. Your experiences with building a sustainable business model, employing these entrepreneurs at the last mile, can you share a little bit more about how this works? What are the challenges while you develop this model?
Yes, of course. Thank you. So let's start with a small calculation. There is 600 million people living in sub-Saharan Africa at least 5 kilometer distance from a health facility in a remote area where they have poor level of knowledge, and they're spending at least 15% of their monthly or annual income on acquiring basic health, which is on average $100 per rural family a year, out of which $55, so more than half of it, is just the transport cost to acquire products. So this 600 million people together are representing 120 million families that are together spending $100 a year. And so there is an existing market of $12 billion out there, which is an untapped market that's functioning very inefficiently. So we, at this stage, believe there is no money that can be reversed back from the government into these remote areas. It's too costly and it's hard to measure the performances. At the same time, what we are doing, we are trying to build on the existing out-of-pocket expenses, bringing savings up to 60% a year to their families, including offering a product and service that offers them convenience and reliability. And exactly as Anne mentioned, it is very important for frontline workers to give them all the tools to serve their community. And especially as Ting says, it's a key to make sure that all the preconditions are in place all together in the ecosystem. So when you talk about the challenges, I don't think the challenge is to organize a truck that brings in products into remote areas. It's not a challenge to find the people to operate and to take the responsibility. In contrary, I am every day amazed again about the potential that community health workers have if you empower them right. And I think Ting clearly explained that how they are able to promote health. I think our challenge is that we are ambitious. We would like to operate at large scale because we see such a potential. We are having 6,000 entrepreneurs and I estimate the market to be 400,000. So there's so much more work to do. So we're building an ecosystem. We do this together and we need to work together. We need to align. We need to have policymakers. We need to have the national governments to be included. We need to have the international organizations like AMREF to join us in the new way of working to empower, improve health outcomes. And we need to build the evidence base. So it's actually the complexity of all the different parties in this game changer we are adding. That is our challenge. And there is no book. Well, as when you made a book that clearly shows how a lot of organizations are facing the same challenge, but this is where we need to work together. And I believe there is a market opportunity. In fact, we have the proof. We can still improve a lot, and we can. Well, the most efficient way to improve is to work together with the existing community-based organizations that know the way in the field, to give an opportunity and just play behind the scenes the role to put all the preconditions in place. And that is an ongoing journey of innovation. Every time there's new insights, new learnings, and it's amazing what we get and come across every time again. But the human capital, to have the right people with the right fit, the right ambition to do so, it's key. And then it's actually replicating where we are ready now. And that's, I think it's an enormous performance so far. And at the same time, we are just at the beginning of much more to come. If you ask me the real challenge at this stage, I cannot mention one. It's like all the players in the ecosystem needs to be aligned, coming from investments, coming from stakeholders, coming from policymakers, coming from having the right partners and the right employees. It comes all together. We believe it's doable, and I think it's a breakthrough. And without support of technology, we cannot operate at scale. And that's, I think, another precondition, more than a real challenge.
Great. Thank you, Yost, for your optimism and the ambition that you spoke about. I think it's very encouraging to hear that. I think we have time for two very brief questions, so I'll quickly go to Anne. And can you share something about innovative finance from your perspective that you spoke about? How is AMREF influencing some kind of policy change to ensure that these initiatives become sustainable? Are you doing anything with the local governments or something that you can share?
Yeah, sure. I can share about that. And innovative financing is quite broad, and it's quite also a new area. And even if you look at it globally, things to do with social impact investments, there's not a lot of data, there's not a lot of policy on it. For example, in Kenya, when you look at our PPP Act and the guidelines, they are largely for infrastructure, for water, electricity, and the like. But we believe that through this initiative that we started, the one that I mentioned earlier on with the other partners, Philips, Acmea, Dutch Development Bank, and others, that once we learn at small scale how these things can be shaped, then we can feed into policy. Then the other thing that at AMREF we are doing in innovative financing is embracing more on social entrepreneurship, looking at other ways we can deliver programs in a more financially stable way, not just relying on institutional donors, which is also very important, but how can we think through within that to come up with models that are more financially sustainable, so that we are looking at both the social returns and the financial returns. And returns not in for us as an NGO, not really as profits, but that it is a model that is able to sustain itself. Then the other area that we are looking at in terms of innovative financing is also the use of market-driven approaches, just working with private sector and seeing how models can be built around that. Because we have, as much as we have what we've been talking about, last mile, people who are far off, we also have very different kind of groupings of populations. There are those who can pay, those ones who can absolutely not pay. So we are thinking around that. It's quite even early to speak about it, cross-subsidization, but it's an agenda that we have increasingly, because also like other emerging markets, like for example, Kenya was declared a lower middle income country. So we have to think more innovatively, apart from maybe just relying on institutional funding, and just to augment also what comes through from the government.
Great, thank you. I think the underlying theme of this discussion has been the power of collaboration, how different people have to come together. And Yost, there is a question from you, from my audience member, Shell, wanting to know, you mentioned a new way of working, collaborating to solve these problems at the last mile. Can you talk a little bit more about what can be done to foster this collaboration or develop this new way of working? We have 4 different people here, you know, somebody who's in technology, somebody at the grassroots, somebody who's developing products, and then you at the on the field. What would the new way of working look like?
The new way of working is, well, is based on a joint mission, a journey we are all part of. And I think all the participants in this panel are actually complementary. And we need everyone in this panel to reach our joint objectives. So what I appreciate of the international community, the universal health coverage challenge, we have put us to achieve together. So we have a kind of framework where we can all refer to, and we are all putting and doing our parts, but as especially being very complementary, not having any conflict in an area where there is an untapped market, where we haven't found solutions yet. I believe the new way of working is to bundle, to give anything you have, put it on the table and try to align. And I believe with the very limited resources we in fact have, we have been able to achieve a lot. And in fact, it's not the team I just referred to, but if you take the whole stakeholder map of people around us, it's amazing. And last week on Thursday, AMREF representatives and health entrepreneurs representatives were sitting with Unilever Director Uganda on the table to see how we can bundle forces, because we are complementary. And there again, we get the same excitement about a movement. We are part of a movement where we are inspiring each other, we are complementary with each other, we are not conflicting. And I believe that's the new way of working, where anyone is invited to join. And by doing it together, by wishing to reach these objectives together, we can make a change, which is a very different way. It actually recently referred back to the post-war time in Europe. I believe people have been so constructive, so efficient to make something out of it. And this is, well, I don't know if I can compare this because I wasn't there by then, but it's a movement, it's an inspiration. And since I have started Healthy Entrepreneurs, I've been inspired every day, and there have been challenges, but we were able to overcome. And we know now that in case there are challenges, we are able to overcome. And even yesterday, just to give another example, we had a meeting in Nairobi where we had one of the largest, founders of one of the largest corporates in Kenya. He gave a TED talk or a pitch, an inspirational pitch, and he really mentioned, in case there are issues you cannot overcome, you start talking, you just put it on the table, because we are all together, we can do this. And I think that's the new way of working from my perspective. Does it have an official form? No. Does it require close collaboration and just being open to collaborate? Yes. And I think that's where we are.
Thank you. That is indeed very much aligned to what Ashoka is also believing in, which is the future of working together is collaborative frameworks. And I think you sort of laid it out very nicely. Before we end, I'd like to invite Randy and Ting to share their perspective on what Yost just said about working collaboratively, particularly with the focus on how that could solve the dual challenges of access and sustainability, if you can.
The solution I've created, ClickMedics, is meant for all parties to work together. It starts with that frontline person who is going to literally be the eyes and hands of any other interventions that will come, whether remotely, foreign, or even local. And it is so important to strengthen that link with those that are right in front of the patient. And sometimes patients themselves, that is really certainly the next step. And it does still rely on the health workers to empower the patients themselves to better take care of themselves, and also to follow up with their own diseases. And that's ultimately where we want to get to. But without other private sector, public sector players who need to improve healthcare for public health reasons, also for funding reasons, and also for sustainable reasons, we have to work together in order to complete the whole chain of healthcare. For years and years, as you know, a lot of times we ran out of funding after screening, and then we focus all of our money on treatments. But then the people who needed more treatment were not screened, because funding a lot of times kind of is siloed on one part of the healthcare process. But realistically, you obviously need to screen the patients, get them the care. After they got the care, you need to make sure they're able to pay for and follow up with the care and actually got better. And I think unless we bring all the partners together, it's probably near impossible to make sure every step of that way happens and that patient actually got better. And I think it's absolutely important that we all have to work together collaboratively, but we all have to work together sustainably as well, understanding that funding and working together doesn't stop after 1 or 2 years. We need to make our work sustainable and long-lasting by empowering the front lines and by empowering the patients, and continue to find ways to work together and not just stop at one step at a time.
Yeah, Ting, I think you captured my sentiments pretty closely. I think first of all, I like the analogy of a chain. Every link has to be healthy, or that chain doesn't have strength. So healthy for me is about economics as well. I think if you look at the end-to-end delivery, everybody needs to have a sustainable economic story to tell. That includes the industry. And there's a question that came on just a few minutes ago about, do we sell the small ultrasound devices? And the answer is, at a low cost, yes, because giving away equipment on an ongoing year after year is not sustainable in that context. Just like the care deliverer locally delivering care, how do they economically make it, and how do we help them? And a lot of it has to do with scale of different solutions co-located, and that helps the economics of it as well.
Great, Randy, thank you very much. I think we started the conversation with Yost organization, Healthy Entrepreneurs, and interestingly, we've been able to talk about healthy economics and healthy collaboration. I think there are these are the main themes that have emerged during this this discussion. Unfortunately, we have run out of time, but such an exciting conversation. I'm glad that all of you could join us, and thank you very much, our panelists for today, and Ting, Randy, and Yost. A great conversation. I hope that we'll continue this discussion offline, and we are still getting questions, which unfortunately we can't take up now, but we'll be sending it to you. Maybe you can respond to them offline. But thank you very much, and do join us for the next session, which will be scheduled and sent to you shortly. Thanks again, and if there are no other questions from our organizers, I think we're right on time. Thank you very much.